Can people virtually hear me?
Yes. Yes.
Okay.
Thank you.
Sorry about that. Okay. So I'm still Gavin Morrow Hall. I still work for the Office of Health Equity, and I'm very glad that you are here. We have people here at Southeast Community Center. We also have people who have joined us virtually. And as I was saying, that since we're the Department of Public Health, you, the public, matter most. And so we will try to get to all of your questions, but more importantly, that we are really here to listen to your questions, to listen to your concerns. If we cannot answer your questions all today, we have your contact information, whether you joined us virtually or you are here in person, and we will get to you as soon, I think we said within a week or so, we will respond to your questions. We want this to be a healthy and respectful discussions, and so to do that, we'll get questions from people who are in the room. We thought we at least 2 people in the room, and then we'll go 2 people virtually online. But if we exhaust the people in the room, which is possible, we will get 2 people online. If you were, for those who are in the room here, we ask that you state your question or concern within a minute, because we really do have, want to get to as many people as possible. We have people who are virtually joining us, or who are note takers who will read your questions if you are virtual.
So they can't see it.
No, because we
I think
changed
that is
it
it.
now, so this is all they can see as a hearing.
Oh, actually, only a few people, but we do have runners in the room. If you're here, you have a community member, you have a question, just raise your hand, and we have people who will do that. And we have our virtual runners who will take care of that. Any questions so far? Then without further ado, it is my pleasure to introduce the Director of Public Health, Daniel Zine.
Thanks, Gavin. Okay, so I just want to validate, people on Zoom can hear us now, correct? And can we hear you? Can someone say something again?
Yes.
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 No one can see us?
Yes.
Can people see us here in the room?
Yes, somewhat.
Okay,
Yes.
you can, I
Zooming
think
in a little would help.
Vincent Fuqua's Zoom.
Yes, they're coming right now to fix it.
Okay.
They can see us, we're sharing the stream. We're sharing this. See, we're sharing it.
Okay, well, all right, I'm gonna get started. I'm Dan. Thanks, many folks, for being with us. So we have,
This is sharing.
hold on, what's going on the screen here? I won't pay
No,
attention.
you're good. You're good.
The goal of this is to have a discussion about budget, but to give you a sense of where we are in the department and some of the decisions we have to make coming up. I want to note, so we have 2 of these, one today and is the other tomorrow at 25 Van Ness. We are wanting to be in the community with people as much in person as possible. Just at a Black African American stakeholder meeting in the Tenderloin, and folks said, we want to see more of you all, DPH and folks in the community listening. And so that is what we're trying to do. I think it's 95% DPH in the room at the moment. So I thank my staff for being here. We've got a few CBOs, most of our CBOs and others are, we will find ways to be with folks. So I thank everybody for participating virtually or in person, and I hope you see we are trying and wanting to all be in a room together or whatever way to we have a lot of work to do together. So I'm going to jump into things now. So are we, can folks at least see the PowerPoint?
Yes.
There's 2 slides left. Yeah.
Oh, sorry. Oh, we have to do the land acknowledgement. I'm sorry. See, we clearly haven't done some of these in a while, so we're figuring out the flow here, Gavin.
Thank you. My bad, my apologies. Let me just kind of show you what we have planned for the next hour or so. Next slide. So we're done the welcome. We'll do the NAN acknowledgement, and as Director Zai has already talked about the purpose of the meeting. during his presentation, will go over the vision, the priorities, as well as the budget overview, what's really going on in San Francisco and the world today. Director Design will talk about the approach to reductions. We'll talk about some timelines so you know where we are, where we're going. And last but not least, we'll get your feedback and have any questions. So, next slide, please. Next slide. San Francisco Department of Public Health acknowledges that we are an unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, forgotten their responsibilities as caretakers of this place, as well as for all the people who reside in their traditional territory. As guests, we recognize we benefit from living and working on the traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First People. Director Zine.
Thanks. Okay, I'm going to try to fly through some context for folks because we really want to get into live dialogue. And I will go through how we've been framing some of the overall priorities for DPH, and then we'll talk about some of the things we had started talking about with this last budget cycle, and some of the decisions we want to make with transparency and input from the community. So first, just to give you a sense of where we are going at DPH, I've heard a lot of questions from the community. What are DPH's priorities? This is draft for input because that's why we are wanting to be in a discussion with you all. But you'll see at the top the mission and vision for DPH. On the vision, we are casually saying, adding the little bold at the end. So the vision of the department is to make San Francisco the healthiest place on earth, which I always think is an amazingly exciting vision. And I think the point about for all people is very, very important to what we do and are wanting to do, because we have tremendous health disparities, even though as an overall city, we are very healthy in relative terms, relative to other places, both in this country and across the world. And so we have three overall priorities, big ones. One is I really want us, and our team wants to continue to tackle health disparities over the long term in a really big, bold way. So we have huge disparities when it comes to people dying early, people of color dying early from a range of chronic conditions. We also have substantial disparities in preterm birth rates, for example. And how do we, as a department, bring all of us together with the community, with other departments, with others, and take the HIV concept of getting to zero and really think about how we eradicate the set of health disparities over time, over the long term, that really goes far more upstream. There's a lot more we want to talk about for that, but that's a really important overall goal for us. The second is us being the best healthcare delivery system in the world, public or private. We as DPH do a lot of direct care. We have partners here that do direct care. We all, I think, provide really world-class care when patients are directly before us. We have a long way to go, though, relative to the experience of care. Do we have access all across the board for folks all across the city? And really, how well we do when folks are not in front of us for care. And the third is tackling the behavioral health and homelessness crisis, which we have many more discussions to come on for that. And for how we will do this, I won't get into too much of this, except I think many of you will note one point around operational effectiveness, rigor, and financial sustainability. We do have budget challenges around growth coming up. We will talk very transparently about that. But we've also heard from many CBOs, and this is a set of CBO engagement meetings, how difficult it is sometimes to contract with or get through the process with DPH, and also to get paid, and how long it takes to actually get cash from DPH when we owe you all money. And those are things that I think materially impact our CBOs. It makes it more challenging for smaller CBOs as well. But it also, if you only knew how much time internally it took from DPH staff time chasing all these things down versus time that we could be working on programmatic things with the community. So I'm gonna fly through these things. So this, we would love further discussion on. Alonzo, let's just advance to the next page. I'm gonna shift now. There's a lag.
Yes. Give me 2 seconds. There we go.
Okay, I'm gonna shift now to budget. Budget is not the only thing we want to talk about, but budget is on everybody's minds. And I want to note some of the budget pressures that we have, and spoiler alert, part of the purpose of this discussion is, if folks recall, when we rolled out the budget this past fiscal year, we had said, as for the second year in the budget, we would work with our community to identify an additional 17 million of CBO reductions. And that is part of what we need to work through. But to give you the bigger goal here, so when we talk about reductions, we're talking about them in the context of a growing budget. There's no world here in which the DPH budget, even in our current budget cycles, have shrunk. Over the past several years, DPH has been growing by 5.5% per year. That's amounted to about $1 billion over the past period of time, 6 years. City revenue over that same period has grown by 3.3%. And so anytime we're talking about budget here, aside from some of the very terrible, damaging federal Medicaid cuts that started coming, I want to know we're talking about how to manage our growth, not talking about reducing our sorry, my phones are going on and on. And our goal really is to partner with the community in helping to make decisions together to make sure that the resources we have are really going towards the things that have impact, aligned with our core mission and values, and in a way that really is done both transparently and with the community. Next page. I'm not going to go through all of these numbers. These go through a little bit of the budget pieces. What you see is how our both overall DPH budget has grown over the past several years. How much of that is local funding, meaning non-Medicaid, non-Medicare, not state and federal funding, but local funding, how fast that's grown, and what citywide general fund growth has been. And so it's really important to note that we are talking not about contracting the DPH budget, but we're just trying to talk about how to manage our overall growth in line with the revenue growth of the city, which is about 3.5%. And of course, we have some really challenging, beyond some of the city pressures I mentioned, we have some very challenging state and federal budget cuts, including with the federal bill that was signed with major cuts to Medicaid, CalFresh, et cetera, that we will come back to talk to you all about. We're monitoring all that very closely, both for the human impact for folks that will be losing their healthcare coverage, and also for major cuts in federal funding that will impact the safety net here in San Francisco, which I think we all have deep concerns about. All the more why we want to start this level of engagement with our community. So as a recap of the 2-year budget cycle that we're in, the last budget, we're currently in fiscal year 2025 to 26. And if folks recall, we did a range of budget presentations, but I know not everyone was able to join those. Part of how we solved our DPH budget, which still grows to about $3.5 billion in this second year of this budget cycle, was we did everything possible to manage our growth and our revenue through administrative efficiencies, through going to get more reimbursement from Medicaid, Medi-Cal in particular, really to do everything possible to preserve services and staff as well. And we found a range of things to reduce ongoing expenditures for including about $31 million of CBO reductions that you see here that we had to go through. We also said in the second year of the budget cycle, we would have to we committed to $17 million of additional CBO reductions. And the reason, but they were unallocated, meaning we still do not know exactly what those 17 million would be. But that would be for the fiscal year that starts July 1. Just want to remind folks of that. The reason why we did that was because it would have been very tough in a matter of weeks to come up with another $17 million of budget cuts to pre-outline in the budget process that happened earlier this year, and would not give us any space for this sort of dialogue. And so what we have said is we intend to have these sorts of discussions and work through how to equitably identify the $17 million of additional CBO cuts that would have to roll into effect for July 1. We've also said to you all that we want to have clarity around that by the beginning of this calendar year so that there's ample time to prepare for that. Next page. And I think this is what the 17 million piece, and note, this is prior to any other budget targets we might receive in this coming fiscal year budget cycle. We already know that we owe and have committed to 17 million of reductions in order to meet the second year of the budget target. Again, this is on top of efficiencies we've already done, other cuts we've managed administratively, and about $500 million of revenue that we DPH have committed to over the course of 2 years, meaning we said we would go find $500 million of additional Medicaid and other reimbursement. Every penny of that leads to a one-to-one preservation of services that for how we use our general fund funding for that. Okay, now we're going to get to Navina. Am I still talking, or is anyone else? I'm still talking. Okay, let's continue then. You can see how deeply we prepped on the agenda. All right, we're waiting for the next page.
That's it.
Okay, so I want to be really, really clear. We do not have a secret plan or even a list anywhere of things that add up to $17 million. We meant it when we said we did not have a plan on the 17 million of CBO reductions that we need to start July 1, and that we would actually want to engage with the community and figure out how to make some very difficult decisions together. So this is the beginning of that process. So I hope you see that like we're good for a word on this, and if we don't have answers, that's because we actually want people's input. Some of the principles that the team has come up with, we want to be transparent and communicate, which we are doing, meaning we are doing before we have an answer, and we want people's thoughts on even the principles and the ways in which we approach this. We do a lot at DPH. We want to make sure that the things that we're funding and supporting, that they are focused on our core mission, that they are aligned with the things that we put up before and that many of us in the community have been talking about, that we do take an equity-centered lens around how we make some of these decisions. We can talk about that much more, particularly for maintaining culturally congruent care and with the CBOs that are able to provide that. And we really want to be grounded in data. And I will say this transparently also, I love everything we do. And many of the things that we do with you all and internally, we do not have strong data and outcomes on. That is a gap that we need to continue to be very clear about everything we do. Why are we doing it? How does it help improve equity and the health of the people that we serve? What are the outcomes that we are tracking? How do we know if something is working? How do we refine that together? That's what you all, the public, should expect of us. We don't always have that level of outcome and accountability data to work through, but we want your input on how best to do that together. Next page. And here are a bunch of things that we want to get input to that we have been starting to talk to our program staff and subject matter experts on to work through a long list of hundreds and hundreds of millions of dollars of CBO contracts that we have at the department. And to say, well, we clearly would love to do all of them. Our team, I think, are fierce advocates for their programs and the populations they serve. And they're also subject matter experts who really understand their programs and domains. And so we're asking them to look at the programs that the DPH program managers and teams oversee and evaluate each relative to how well it fits into the strategic direction of the department, the program fit, The impact on equity and reach, meaning how well these programs, so sometimes we might have a very small program where on paper, it's like, why do we have a program that serves 12 people? I don't think we have a program that only serves 12, but the impact on individual communities or local communities or communities of color with the right CBO, that's very important to us. And so this is not just about scale, but we want to make sure we're having an equity and a very specific lens in that regard. As we're also thinking about cost efficiency. Some of our contracts, we're looking at what is the actual cost to serve per client, per individual. And when we look at things in that way, you just get very interesting results sometimes. It doesn't mean it's wrong or bad, but there are things that we have to keep in mind, and at least I'll be able to look at quite transparently. Certainly some of our CBO contracts also generate revenue, meaning we can get other forms of reimbursement for that, and we have less general fund need. That's important for us to note, as we're just trying to balance the overall budget and make a bunch of trade-offs together. Do we have any data on performance, some of particular contracts, and how impact on broader population health outcomes? And so these are things we're looking at. Nothing is formulaic. And I think at this point on the next page, what we're really wanting to do, if you can flip to the next page, is and on some of the timeframes, as I've said, we are over the next several months going to be working through this as a team. We want to be having these discussions with the community. We want your input around this. And we also expect instructions from the mayor's budget office for additional solves potentially for this upcoming fiscal year. So these discussions are going to be very important for both the 17 million that we've already had to commit to, as well as anything else we might have to commit to. And the goal of this discussion is really to start this dialogue, make sure we're all on the same page for the context that we're in. And when DPH teams are looking at things, this is not because we don't love our programs. This is because we do have to make the math work, and our expense growth has to be closer to in line with the city revenue growth. We do have to make tough decisions. How we make that is very difficult, and we want to make sure we're not doing that by ourselves as DPH. We're doing that with the community. Okay, and I think we're gonna we have a few questions.
Yes.
There we go.
Thank you, Director Zai. As I mentioned before, we're gonna take questions from, I guess for virtually, maybe we have one or two audience members here, but we'll ask that you keep your questions or comments to 1 minute. If you're joining us virtually, we have put your question in the chat, and we will have someone who will read the chat, so Director Zai can respond to your question.
Not just me, and to be clear, not just me responding, but there's a bunch of DPH, the team here. And so this is a dialogue, and I should have said on the questions, so we would love questions on the overall context and also thoughts and advice on how you would be approaching what we're about to approach together. So I don't know how best to say it. We're being extremely transparent and collaborative from the very get-go. I see Priscilla's got a marker with a whiteboard there. And so, Gavin, I'm going to give it to you now.
Thank you.
Sorry, the chat is disabled for us that are joining virtually. Can you enable it so we could put our questions in?
Oh, we will do that. Anyone in the room have a question? Yes. Hold on 1 second. Hold that thought.
Hi, is this on?
Yes.
I'm Melinda. I'm with Leah's Pantry. We do trauma-informed nutrition around San Francisco. I have a food security advisory group here in Bayview. It's full of older adults, if you will, 27 of them, and we do a lot of chronic disease prevention advocacy around Bayview. And I seen you guys in the neighborhood doing like very similar things to me. I talked to one of your staff. They didn't seem too interested in it. We do have like a lot of data backing us. We did a community needs assessment. But we were previously funded through SNAP, which is gone now. And I noticed that you guys, your vision was not chronic disease prevention, but health disparities. Tackling that, and I think it aligns really well with our project. So my question was like, if I wanted to collaborate with you guys, not for like funding or anything like that, but just to collaborate to maybe like get ideas. You guys are the experts when it comes to like, you know, the fancy wording and stuff like that. So outside of funding and everything, are you guys open and willing to maybe collaborate or like consult with the group? They're very interested to speak to like city officials and everything about all of the findings that we have, share some of the strategic plans that we have, and things like that. And by the way, the group is called the Bayview Food Security Advisory Group, if you want to look it up.
Thank you so much for that question, and most definitely.
Oh, sorry. One more thing, and if you are, how would I go about doing that? Sorry. Yeah.
Happy to take your card afterwards,
Okay.
and we can connect you, but the Shape Up San Francisco Coalition is a place where we talk about chronic disease prevention, food security task force as well, and so, let's connect. I'll get your number and, we'll reach out to you because this is exactly the kind of group that we would want to partner with and work together with.
Yeah, another question about.
Oh. Do you want me to try to summarize or you want to do it?
You can summarize.
Oh, can you hear me? Okay, so I didn't see anyone saying, can you hear me? I mean.
Yes, they did. They can hear you.
Yeah, so the question was, there's a group in the Bayview that does chronic disease prevention, specifically food security. And how can they collaborate with the department? That was the question, essentially.
And can we hear from virtually? Who's taking the questions virtually?
Feel the chat here.
Okay,
Naisha?
we have quite a few questions from the chat. So first question, are there specific funding streams that are more vulnerable than others? For example, those contracts funded through general fund.
So the practical answer is the $17 million that we have to find are clearly general fund dollars because the gaps for what where we need to balance the city, our budget is local dollars around that. So a contract that is 100% funded general fund only has obviously full general fund impact versus something that might be 65 or 100% funded by Medicaid or some other funding source. But I think I just want to be part of what we've had lots of discussions with the team around too is, I mean, that is relevant because some of the non-general fund funded contracts pull in revenue into San Francisco from the federal government or the state. But we also know that those are certain types of programs, and there's a bunch of really exciting, cool things that we get to do here in San Francisco that are fully general fund funded, and they tend to go much more upstream. And so those are things that we're highly cognizant of.
Thank you. Naisha?
Okay, can you say more about DPH's vision for prioritizing behavioral health and the needs of the unhoused?
Sure, I think I saw that question from Anna, and Anna says also, as costs increase for DPH for all residents, they also increase for CBOs just to make, yes. And so maybe I'll start with that second point, Anna, I think you were making. And we've heard from many CBOs about the cost of doing business, the CODB increases, which this year were 1.something%, which is not zero, but it is far less than inflation, as we know, which we are all struggling with. And I think that's why we are wanting to have these discussions together as a community. I mean, the city's budget is growing at 3.something%. I think next year's forecast is 2.5%. We already are at double that. We're at 5.5%. And that's with a 1 point something% CODB, cost of doing business increase. And so, like, we know we need to have appropriately funded CBOs to be able to do quality work. You need your workforce appropriately paid so that you can retain them and folks can do really important work. And so the trade-off we constantly make as well, as we're managing the growth, not only of the existing programs, but you see there's all sorts of new things that come to us. How do we prioritize between that versus just fewer services? So we can have fewer programs that are with higher cost of doing business increases, or we can balance range wise. I don't know the exact answer to that, but Anna, I think your question is a very important one, and is one that frankly I think we've been wrestling with as we look at how to manage to get growth of the budget. This is not for us an exercise about reducing the DPH budget. It is just managing the pace at which we are growing. And on the behavioral health side, I would just say there's a lot of work. I know, Anna, you've been in some of our discussions. We want to make sure we can, from a health standpoint, we want to make sure we can get folks access to treatment and services much more quickly. There's a whole strand of work, which is folks who are we engage with in the street, whether they're housed or sheltered or not, and have any interest in a range of treatment options. We want to quickly do that. We want to make sure that once we get someone into here, we have better progression and movement for folks when they want the next level of treatment. And I think we were just looking at the number of days on average it takes to get someone into residential treatment right now is about 3 days, which is better than some areas of the country, but it's still 3 days too long for someone who has made that decision and is ready for treatment. And it takes 3 days to get them into a program on average still. So those are all things that we're working on. So it's expansion of treatment capacity, and it's us all working together so we can successfully help folks kind of move through that continuum as well. There are many other pieces that we could talk about, but I appreciate the question. And if Hillary were here, I would give it to her.
Okay, next question. With regards to the program evaluation and use of framework, will you share what metrics you are using to assess? For example, cost efficiency or cost per client. How do we know what is considered cost effective or a reasonable cost per client? What metrics are we using for equity, for example?
So I'm going to hand this to Naveen in a sec, but I think part of this is we would like input on that. And I'm being very transparent also for all of us. I think our CBOs and our own DPH staff included, we obviously all would say we want cost efficiency. We don't have any, we historically have not looked at our contracts at cost per individual service. It's kind of broken down by all of the different units of service and such. And so I think part of this is we would love people's strong counsel and advice on how we should be thinking about these different pieces and how we also balance some of the equity pieces that you mentioned.
Questions related to that from under question. I'm Anna Robert from Mission Neighborhood Health Center. Just how are you thinking about comparing like the cost of doing a particular service at DPH compared to CBO? So for instance, I'm not certain what Leah's pantry does, but suppose that they can distribute X number of meals at a cost much less than a similar program within DPH that might provide the exact same service. So like, is there a process for sort of looking at, a lot of the CBOs, we do similar work to DPH, but just in different programs. And so how are you going to be thinking through that as a way to contain your costs and make
Room. Are we not muted?
No, you're not muted.
Okay. All right. Well, everyone, I appreciate your patience as we sort through this. If folks didn't hear the question from Anna Rivera from Mission Neighborhood Health, it was how do we think about what we do with civil service DPH staff versus what we contract out for, given the cost differentials. And I said, well, that's a very complicated question to answer that I probably should not answer right here in front of everybody. Thank you for that.
Within your decision making around, if you're gonna cut a CBO, like if it's included in some of your decision making around, if you're making a cut to a CBO contract, to not. Yeah, I just feel like that should be a part of that decision making. And I really appreciate, as a D10 resident, I appreciate all the work that the team is doing to really bring us into a financial, more sustainable place. And I appreciate there's been no layoffs at DPH. Also, but there's been layoffs in CBOs as a result of the cuts. And so it's that balance. And I think like we'll have to like be considering that as we're engaging around this.
Yeah, I thank you, Anna, and I affirm that point, and also the cause and effect piece that you're noting. Certainly, I think we're cognizant of that. For my staff, we're also participating. Like it's, we clearly have an obligation and legal requirements also around our civil service staff that I'm highly cognizant of. So it's a great question. It's a very complicated one, and I wish I could make everybody happy in life.
We'll get back to if we can. Are there other questions in the chat?
There
Nice.
are a bunch of questions in the chat.
Okay, thank you, Nation.
What is DPH's plan for cost of doing business increases for CBOs and other contractors? Should we just plan for that to be cut across the range of contracts?
Jenny, do you want to talk about that? I'm going to ask Jenny Lilly, our COO, to come up with that.
I know. Sorry.
Hi, thanks for the question. I mean, traditionally how we worked on the CBO COLA is actually through the mayor's office. It's a coordinated effort through as part of their budget process. And so at this time, it's not DPH unilaterally making a decision about the COLA itself, but we will work with the mayor's office as we have in prior years in terms of allocating the CBO COLA moving forward. And I don't have the exact percentage, Emily, I don't know if you do, but there is we had 1% this year, and there's another increase cooked in for this upcoming fiscal year. So there is currently in the budget a COLA baked in, and we can get you that number. But we'll continue to work with the mayor's office through the budget process on this.
Here you go.
We'll do it. Okay, we have time check. It's about 12 minutes of 5, and so we can keep our questions quick and thank you.
I'll make mine super quick. Hi, I'm Allie from Sister Web. You began by stating what you're already working on, noting the really drastic impact that the delays in contracting and delays in payment has had on CBOs, but I didn't hear a clear plan for how that will be different moving forward.
It's a very good point. We are indeed, so in terms of, we are wanting to make sure we are holding all of ourselves accountable. So certainly CBOs, and I think we as DPH also need to deliver and improve as well. And so we do have a bunch of work internally on the contracting, the invoicing process. I will also be transparent. The more we pull things apart, the more it's made our heads hurt. And so we have major work to do. For example, I'll just give you one example. When we look at our regular invoicing process for any CBO that is on more of a cost-based or invoice-based reimbursement, the standard work procedures, like when you think of all the different folks that have to sign off, even outside of DPH and steps, it is a 6-month process post the start of a contract before a final invoice is all settled on and people start to even have payment moving. And that's if everything goes according to plan. And many of you all have comment points. 9 to 18 months after the fact, still not fully settled up. So those are the things we've been trying to peel apart, because it's one thing to try to hit the 6-month piece, but that's still going to be deeply unsatisfying in a range of ways. And so there are other city departments beyond DPH that we are talking to take a look at why some of the processes exist and why they have to be so difficult or challenged to manage. The goal is to get to a faster time to payment for DPH contracted CBOs, as well as an easier contracting process. Okay, where should we go next on the questions?
Will Prop 1 bring in any new or additional funds for DPH?
So Prop 1 will modify a range of funding streams. Actually, I should say there's a few different things for within Prop 1. There are also some grant funding pieces for new beds and capital projects, of which we DPH have been awarded some. We are applying for the next round, and we know some of our CBOs have been applying for that. We also know the state has changed the framework with a lot of Prop 1 funding from MHSA to BHSA, so incorporating the substance use piece much more. We've had substantial discussions with the state. There are a whole set of teams working on that. And so there are a lot of decisions to be made about how funding is used versus a large windfall of additional funding coming, I think, on the Prop 1 side. But there's a lot of capital funding for new projects. Obviously, the challenge with capital funding is you need operating dollars to support the capital funding to actually run those programs on an ongoing basis.
Ralph, we'll come back to you.
Me?
Yes.
Okay. What accounts for the increase in expenses budget for DPH? If cutting CBOs is an option, is maintaining the DPH budget as flat an option as well? Or not funding new programs, et cetera, to sustain current programs?
I didn't hear the fully begin, but I just want to make sure it's good. Our budget is, we are still, can you actually, now you should just read the beginning of that question again?
Yes, what accounts for the increase in expenses and budget for DPH?
So, okay, thank you. So what accounts for the 5.5% growth? When you break it down, there's a range of pieces. Certainly, we have a large base of staffing, including nurses literally running our hospitals and such as well. And we have labor agreements there that accounts for a substantial portion of our growth. We also have expanded CBO contracts. We both have the existing things, and every year everybody's got many exciting, great ideas. Our program teams have great ideas. You all in the community have great ideas. We increase the number of programs we fund. And then I know you all believe that, and I recognize this, the cost of doing business increase is too low, but that has been about 1.5%. So you add all of those things up and you get to the 5.5% that the program has been growing at. And again, our goal is not to get to negative growth. Our goal is just to try to figure out how we balance that overall growth a little bit more in line with the 3% that the city's revenue base is growing at, 3% per year.
And I promise back here, and then we'll get to you.
Well, I know you guys are probably tired of hearing the word CBO, but
No.
I also sit on the soda tax committee, and as you guys know, the mayor zeroed out all of our recommendations for community-based organizations doing a lot of amazing PSC work throughout San Francisco. So my question is, besides the CBO, are you guys thinking about maybe covering some of those costs from people who have lost funding from the soda tax? Or no?
I went out with the team and visited some of the programs and felt some of them were incredible. We're here in the Bayview with all my USAs, for example. And I would just say this is why we're trying to engage, because there's a ton of difficult decisions we have to make across the board. We have not come up with a list of how to do that and balance out the parts of the budget. But that's why we're starting this engagement much earlier this time. Thank you.
Then Veronica.
We should switch back to the question. Yeah. Hey, Veronica.
Good afternoon, and thank you. I'm sorry for my tardiness. So I have bunches of questions, but I know we have a little bit of time, so I'm gonna be kind. And I want to kind of piggyback on the sister who talked about the sugary beverage money being, I too was on that committee at one time. So with that money being removed, where is it being repurposed? Who gets it and how? Question one. Number two, how is DPH intentionally using data that tells us our highest population risk to guide the funding? Because what my experience has been, we collect a lot of data, but then we don't align to be intentional on how our money is going back into community like Black Infant Health or sugary beverage impacts, food security. We've been funded for the same amount of money for 5 years, and yet the cost of food is increased dramatically, and it's impacting a lot of the communities. And with the current political climate, it's even worse.
Thank you, Veronica. And I think I will say one piece you missed the beginning of our discussion. If we had unlimited funding, or could we, there are a bunch of things that we want to do, including when we look at health disparities, both on the preterm birth side and on premature deaths, there's a huge disparity by a whole range of different groups. And we want to actually drill down into that at a zip code and a neighborhood level. And some of our investments that are more upstream, we think should follow more of kind of that incidence and the set of things that we want to tackle together, to look at our current CBO contracts and say how much they align with solving some of the structural issues that will drive disparities, whether it be, again, on the mortality side or a range of chronic disease indicators we've been looking at, or even preterm birth rates. I think the question for this group too is, our team is rearing to do a bunch of things, and we are already trying to manage some of the budget context here with many of our existing CBOs telling us that folks need more funding for cost of doing business, right? And so these are difficult decisions that we have to make together around that. And I said, Veronica, we don't have like a secret plan yet. Like, we are wanting to actually listen and engage and start this discussion, have people think, send us thoughts, send us things that they think we should look at, etc. And I also, on that, I want to note one thing. I saw Dr. T from the AIDS Foundation had a question come in too about, I don't remember exactly the question, but it was around when we're looking at even cost efficiency or other things of CBOs, you're going to have smaller CBOs sometimes being less efficient when it on paper, just as a smaller organization, but some of those CBOs are going to be incredibly important, culturally congruent providers and entities. And the outcome of this can't be that only big CBOs maintain their funding and all the little CBOs that are less able to maintain the infrastructure lose funding. And I think our team is highly cognizant of that, which is why we want to note that upfront. But we do want to make sure we're looking across the board and at these things. And in some cases, I think we're very interested in understanding how direct CBOs can partner together so they can access infrastructure in other ways that allow smaller, culturally congruent CBOs to be able to thrive and provide very specific expertise and culturally congruent services, treatment, care, whatever it may be as well. So I appreciate that range of questions.
We can go over just a little bit. Naisha, if you give us 1 or 2 more questions before we wrap this up.
Yes. Can you also look at how to be more efficient across the city? It feels extremely wasteful for SFPD to continually harass our clients, i.e. encampment sweeps, which just sets our work back. think that was more of a comment. Let's scroll down a little bit. I would like to know if you are open to overhauling the contracting and invoicing process. We have state and federal government contracts, and both those government agencies are far easier to contract with than SF. The efficiencies created from an overhaul would be game-changing for CBOs and DPH, reducing admin costs greatly over time.
Yes, is the short answer, and I think if folks have clear recommendations, I think our team would welcome those. I do not come from San Francisco, come from the federal government, Massachusetts, other places, and I've never seen a contracting process like this everywhere, anywhere. And so I think our team wants to figure out how to substantially revisit some elements of how we do things. But some of those discussions require discussion with folks outside of just DPH and understanding the legal framework and other fiscal requirements. But this is not good for anybody. For CBOs, for how you have to use time, likewise for DPH staff and what our team could be focused with you all on. So yes, we fully agree.
One more question, Aisha?
And there's just a couple of questions around the soda tax cuts, which I think Director Sy addressed.
And I do want to, Veronica, you asked, where did the money go on the soda tax piece? I think, and again, this is my first budget here. The soda tax funding, about $1 million of it was projected decrease in revenues, which is good. Fewer people are drinking sugary drinks. The other portions were moved over to HSA for direct. I know you have many opinions about that, Veronica, around direct food provision. But I think the broader piece is, and what I'm excited and hopeful to be in dialogue with, and our team is as well, is even if you look at the advisory group for what the soda tax group has been working on, some of the things that for how we want to look at our broader portfolio of investments, like the types of community-based recommendations and insights and voices coming out from that, we want to think about and incorporate into not just the slightly shrinking pie of the soda tax, but how we are making investments into the community more broadly around that. So I think those are the types of discussions we want to have alongside very neighborhood by neighborhood based discussions as well. If we had unlimited funding, our team has many ideas about the things we would do. Part of this is going to be we want to do new and additive things all together, even whilst we have some of these budget challenges, which is, again, this is not about cutting our budget. This is about trying to manage the pace of growth, but that still requires difficult trade-offs and decisions we're going to have to make together.
Thank you, Director Sy. And thank you, wait, one more?
One last question
Okay.
that might be an important one was around RFP release dates. So the question is, their contract ends in June of 2026. Will there be delays for programs that continue to be funded? Given the looming cuts, will there be delays in release of RFPs?
That's a great question. I mean, continuity of service is one of our priorities as we go through this budget process. And part of the reason, and it drives some of the timeline around announcing the reductions proposed to meet the $17 million target. So we believe if we have that information available by January, we should be able to get through the processes as appropriate, particularly those that do require through charter mandates to go through the board. So that is our goal. So to actually announce them early enough so that CBOs have enough time to plan appropriately for a reduction. And so they're not just given, 30 days notice. In addition, to make sure that we have a continuity at this point, we are not slowing down RFPs at this point, especially if we know that there's a service that will be reduced, and I think that is something we will revisit once we have additional information about what we plan to do.
Thank you for that question. And thank you for all the people who have called. This meeting's been called tough, but we also know it's quite scary for a lot of people. And staff of DPH understands that. We hear you. This is our first meeting. It will not be our last meeting. We will take the information that the questions you've given us, the information that we hear tomorrow. And as a team, the DPH team will look at this and be responsive to your concerns. Until that time, we are most grateful for the time and consideration and for the thoughtful questions that you raised here. There'll be an opportunity tomorrow at 25N, that's at 3 o'clock, I believe, 4 o'clock. For those of you who do not get those questions, that will be an in-person meeting exclusively. But please come down there and share your concerns and your hopes and your dreams and all those things that make San Francisco what it is. So have a good evening, everyone.
Yes. Oh, no, thank you. That was very good.